Great. Thank you so much for the opportunity to share with all of you about the aging care in Taiwan, what kind of challenge and opportunity we might face in Taiwan. Okay, so this is outline of my presentation. At first, I will talk about why elderly care has become the major care issue around the world for every country. Then I will show you the current aged service that we have in Taiwan, including the long-term care service and the newly renovate the policy in Taiwan. And finally, I would like to present to you what we nurses can do in providing the comprehensive approach for care for elderly adult with disability. And population aging is an issue that all developed countries in the world are facing today. In 1993, you can see Taiwan officially entered the aging society. It is estimated that by 2026, but actually it's just this year. The year has been pushed 1 year early. So it is expected by 2025, Taiwan will become a super aged society. Therefore, we need to prepare our response to the challenges brought about by the rapid population aging. So especially in Asia, compared to the experience of Europe and North America, the aging pace has been dramatically increased after 2020. Unlike them, Europe and North America, the developed countries, they have a longer and smoother time period for them to prepare for this silver tsunami. Now, probably is the time for us, for all the Asian countries, need to start to well prepare for the aged care before it becomes too late. So why development of elderly care is so important? As you can see here, maybe 20 years ago in Taiwan, the average life expectancy for both male and female is not long enough for them to become elderly. But look at 20 years later, the population age has become so severe. So you can see the life expectancy has dramatically increased for both male and female. So as the life become longer, the elder population become larger. So the proportion for those in need for chronic care and disability long-term care has become dramatically increased. So need for medical service and long-term service has become a great need for not only individual, but also for the family. But look at the change of the family and community structure. We used to be that have the family members, especially the female, stay home, taking care for the elderly with the disability care needs. However, after industrialization, almost every female has the opportunity to work outside of the family. So in the good old days, maybe the wife will take care of the husband, and maybe the daughter or daughter-in-law will have to care of their elderly family. But right now, because of the industrialization, everyone have to go to the work. So the care responsibility will not be only be the responsibility of the family. It becomes the family of the nation, of the government too. So the paradigm of the aged care has shifted from family to the government. So what kind of consideration we will have faced after this newly developed aged care? You can see here, as the elderly population become a major concern for the care, some consideration for future aged care has changed. For example, the next generation are more educated. Then we will have a better pre-planning for what we want to have for our own long-term care. And we will require more quality of life and healthy living preparation. So it will be more prevention focused and some healthy longevity activity will be required. And furthermore, a lot of them have been thinking about early retirement because we are requesting for better quality of life. So what we need to prepare for our later life has become a major concern for our generation. So we are not seeking for prolonged life, but a prolonged healthy life. So maybe a lot of us will prepare for advanced directive for our future preparation, and we will request for less prolonged institutionalization. So we don't want to be cared in the long-term care facility. We want to stay home as long as possible. And maybe if the total care is needed, then whether or not they will have another option of assisted death will become a plan for our this generation of the elderly too. So here is the paradigm that become a major concern worldwide, that aging in place has become the mainstream. So what does we mean by aging in place? It means that elderly people, including those in need of care and support, should, or whenever possible, be unable to continue living in their own homes as long as possible. And that, whether it's not possible, they should be unable to live in a sheltered or supportive environment that is as close to their community as possible in both social and geographic sense. That means whether or not they independent living is possible, they want to live at home. If the independent living is not possible, the shelter or supportive care should be close to their home, as close as possible. So government policy in aged care has shifted from providing direct care, the direct institutional care to support our elder adults, shift to live in the community as long as possible. And here is our vision: to build a healthy, happy, and vital and friendly aging society. What do we mean by healthy? That means we want to extend elderly health life expectancy and improve their quality of life. And they want to be happy in the community. Therefore, we need to strengthen their supportive network and promote generations harmony, because nowadays the elderly will not be able to depend on their next generation to take care of them directly. Maybe they will have to happily accept the fact that they will not be able to stay at home to take care of them. And whether or not we have built up a friendly environment, which include proposed life without obstacles, and diminish any discrimination for elderly so that they can stay as a community. And most vital thing is to encourage a diverse social participation, enhance their self-esteem of being elderly. So this is what government will do. As you can see, this is a comprehensive care providing system that proposed by the government of Taiwan and look at the elderly's continuity of care needed from healthy to totally dependent on their daily living. We will provide the life care service system, the medical care system, and the long-term care system. And how can we coordinate all these three systems together? It's by different care plan, including healthy cities and integrate health plan for the elderly and the comprehensive long-term care system. And among these three systems, different plan has been laid out in our government and with different project service provided for the elderlies. And we were going to look at that step by step. So first, we will start with the active and healthy aging. In this system, there are four key components, including disease management and preventive service and age-friendly health service. All this require a redesigned system for healthcare system. And third is the community health promotion for older persons and toward an age-friendly society by building a healthier community. And all of this actually is based on the guideline provided by WHO since 2015. And the goal of the healthy aging is to provide a preventive care to enhance elders' intrinsic capacity in order to shorten their days in long-term care through health service, long-term care, and environmental redesign. For example, in environmental redesign, we will promote a capacity-enhanced behavior so that they can use what kind of ability they still remain and remove all the barrier for them to participate with the limited function they have and try to compensate for those of their capacity. And in the long-term care system, the most important is try to limit their time of the disability, so to ensure their dignified late life by support their capacity enhancing behaviors. And finally, in health service, what we can do in the preventive oriented care is try to enhance their capacity by prevent chronic condition from happening by early detection of any problem. And if they do have any decline of capacity, we will have a lot of prevention strategies, try to have them maintain their health condition as long as possible by control their chronic conditions. And this is the most updated published of WHO on the framework for countries to achieving an integrated continuity of long-term care. And just like we demonstrated before, this is also include in the integration of the three systems, including health system, long-term care system, and how to redesign the environment. But the emphasis, again, is on healthy aging is an important public health issues. So that all countries have been focused on prevention before they fall into the need for long-term care. And in Taiwan, to promote this age-friendly cities, we are following the guide of WHO, which are including this 8 domains, such as social participation, transportation, housing, community support, and health service, etc. So comprehensively, how to build up this healthy environment, how to use the friendly environment to encourage elderly, even with disabilities, to stay in the community as long as possible. And especially with the majority of elderly with chronic condition, as I mentioned, 80% of elderly has at least one type of chronic conditions. So we need to make the healthcare service accessible, convenient, and most importantly, friendly for them to use just in the community. They create a coordinated care for chronic condition are important for us to reach the goal of to prevent any deterioration of the condition. It's the first step that we need to achieve. So use the chronic condition like hypertension, hyperglycemia, or hyperlipidemia, or CKD as example. In the community, we will promote this kind of model. For example, we provide the health promotion in workplace and community. So for this general population, just in their workplace or in the community, they will be able to provide this measurement of this early sign. For example, the West circumference or BP or blood sugar just in the community for early screening. And if they do have the finding, then they will be referred to different system of care. If the finding is normal, then the community will continue to provide this kind of health promotion and regular checkup. If we find out they are high risk, for example, they will have abnormal reading in high blood pressure or high blood glucose or cholesterol, or even they have unhealthy behavior like smoking or obesity, then they will have this kind of health management program established in the workplace, community, or public health center, or even referred to health promotion hospital or clinic for them to continue control of the condition and close monitor of their health conditions. Unfortunately, if there's findings, if they got diagnosed with this kind of disease, then they will be referred to the disease management with different type of disease. So this is a comprehensive model they provided in Taiwan to control with elderly with chronic conditions. And all this will be done by the aging-friendly hospital and health services. So in order to do so, we will have to redesign a hospital or health service for them to fit in what we call age-friendly. So we are so happy to share that based on this framework, the Taiwan's framework of age-friendly hospital and health service, we start to accredit every hospital whether or not they can meet with the criteria of age-friendly hospital and health service. And this has been based by WHO's principle, including age-friendly principle and standard health promotion hospitals. And at first, this has been accredited in 2000s. And we are happy to share with you in this year, 888 healthcare organizations has got the recognition to be recognized as age-friendly hospitals. And what kind of strategy they will do within this kind of friendly or age-friendly hospitals? The most important things is that they will have to connect with the community and social welfare and medical service. So the health service is not only due in the hospital, they will have to coordinate with all different settings and with the priority topic, including physical activity for prevention, nutrition, oral health, smoking cessation, mental health promotion, and social participation, and most importantly, early screening for any diagnosis of high risk. So that's part about the healthcare service. But on top of health service, we will also look at the environment, try to look at whether or not the environment is healthy or friendly. So we established this WHO's age-friendly city, and this will including the 8 dimensions, including the outdoor space and building, whether or not they have friendly transportation, housing, including elderly to social participation, and respect and the social inclusion for elderly to work or to live in the community, encourage for them to have the further participation, even for their rejoin of the workforce. and whether or not they have a friendly communication and information. For example, the size of the word, whether or not it's friendly for elderly to read, and community support and health service. So all this will require the collaboration, coalition, and the partnership between central and local government and across all different sectors. And the age-friendly city projects, we are happy to share that in 2010, starting from Taiwan, only have one pilot cities. But in 2013, all 22 counties and cities in Taiwan has joined this age-friendly city and signed the WHO's age-friendly city with the doubling declaration. And we are so happy to share with you, Taiwan is the first country around the world has been all recognized with this kind of declaration. But no matter what have we doing in the promotion, no matter what, the need for medical and service and long-term care will increase with age. As you can see, in average, one in every one in every 14 elderly will have. I want to click on this. Oh, I'm sorry. This is what I want to do. Have it's the arrow moving. So as you can see, for elderly, elder than 65 years old, maybe 1 in 14 elderly will have the need for long-term care. But as soon as they reach the age 75, in statistic, we can find that 1 in 5 elderly will need long-term care. But as soon as they reach age 85, 1 in every 2 elderly will need long-term care. And for as they become elder, it will cause a super burden to the family caregivers, and the responsibility of care is not only on family alone. The government should be responsible for planning the long-term care. Why? Because you can see the burden on young people will increase from 1 in 5 in 2018 to 1 in 2 in 2040. So especially on average of 1 elderly person for every 2 young people will have to take care of the elderly. And not only that, because of decrease of the big family, we used to have the 3-generation families, but nowadays it become more of the STEM families. So that means only elderly with their young kids live together. So elderly, especially in our generation, will not have the intention to live with our children because they know that their children will not be stay at home taking care of them. So they have to increase the intention of living with a spouse alone. So that means is elderly taking care of elderly when the family become elder, right? So nearly 30% of the elderly population is living alone or is cohabiting with their spouse only. So that means increased potential for living in the residential institutions. So what do we mean by long-term care? So long-term care is a variety of the service which help to meet both the medical and non-medical needs of people with a chronic illness or disability who cannot care for themselves for a long period of time. So long-term care can be provided at home, in the community, in an assisted living facility, or in a nursing home. So long-term care may be needed by people of any age, although it is a more common need for senior citizens. So this is why Taiwan start to establish the long-term care service. And as you can see here, we established our first term of long-term care early in 1998. But to be honest, in this long-term care policy, there has been more focus on institutional care. That's against the worldwide movement. So we start to plan for community-based long-term care. Start with the pilot plan, starting from year 2000 and not until 2018. We start off our first version of 10-year plan for long-term care. And starting from here, we start to think about how to build a community-based long-term care. And in 2015, we have established Long-Term Care Service Act. And in 2017, because the dramatic increase of the long-term care, we established Long-Term Care 2.0. So no matter how, the system, the philosophy is like this. The long-term care plan is a single entrance plan. That means the elderly with the long-term disability need will go through a single entrance, and only one gate provided is the long-term care management center will assess and evaluate their need and provide a care manager to coordinate all the elderly or disabled need and provide all the consultings, and if needed for other care, for example, transportation or other care, will provide a referral, especially if the medical care is needed. And it works like this because it's a tax-funded system. So government have absolute power to control the entrance of the long-term care system. So as those is in need with the qualified criteria, then they can submit application to the long-term care management center, or the elderly or their family member can dial 1966 directly, and the long-term care center's care manager will answer the phone, and they will send the care manager to the house of the elderly to assess their disability level based on the multi-dimensional evaluation, not only on the level of their disability, but also with the support or with the problem behavior that the elderly might have. And then after that, we'll write up the care plan and resource integration to decide what kind of service will be most needed by this elderly. And the long-term care service center will be tracking and the quality control with all the service needed for the elderly. But because it's a tax-funded system, a co-pay system will also be required for the elderly when receive the service. And the goals of the long-term care is the 3 A's, including availability, accessibility, and acceptability. Therefore, a community-based model is the first priority. And of course, when they are in the community, how can we integrate this kind of health service for the elderly? And for those still healthy, we will try to provide all this preventive care service for elderly so that they can prolong their healthy life and stay in the community and postpone or delay their times to fall into the long-term care. And this is comprehensive community care system for long-term care system. And in the community care centers, they will provide or refer the elderly with different service needed through the home visit or through the phone call, or provide a meal service, or provide some activity of health improvement. All this are through the primary prevention, so they will not need the long-term care. But as soon as they has been evaluated by the long-term care management service center as the with the need of the long-term care, then they can be referred to home care, community care, or institutional care. All these are the formal care resource. In the home care resource will include home service, food service, and assisted tour service, or even the rental of the durable equipment for the elderly to provide those barrier-free environment for them to stay at home. Or if they have the medical care need, the home nursing care will be going home to provide direct to the elderly. And of course, in home, they will have the rehabilitation care or respite care. But they can also receive care in the community. They can go to daycare, or elderly's caregiver can receive the family supportive service. Or when we want to transplant from home to the medical care institution or the community care center, they can order the transportation service and other services like this. And finally, if the family resource is not able to take care of the elderly at home, the elderly, maybe the disability is more severe, then the other option is institutional care. So they can be cared by the care facility, nursing home, or dementia care institutions. And this is a holistic care model in the community. That means the elderly at home, if they have the medical care needs, then they can have the transportation, as I mentioned, send you to the healthcare facility. On the other hand, the healthcare facility can also send the healthcare team to the home of the elderly, for example, home health care nursing or home service to provide the care at home. So the transportation is to have the elderly moving from the medical care facilities or other life and supportive care systems. And in here, for the life support preventive service, that means to establish the ABC model that I will explain later in later part of my presentation. That means they can stay home to remain their healthy living as long as possible. But if the living is not be able to stay, then the long-term care management center will jump in to decide whether or not the home is not longer a healthy place or a longer a safe place for the elderly. Then maybe the institutional care is the only option. So the integrated healthcare and long-term care service is the hope of the long-term care 2.0, is that by integration of the healthcare and the home, so that they can stay as home as possible to receive the long-term care service. First part of the health cases can do is to provide the prevent frailty. They will including a lot of programs. For example, the muscle strengthening exercise, the life rehabilitation training, or provide maybe meal service for ask elderly to come to have the meal together to encourage their social participation, provide the nutrition and oral health and health education for them to have the knowledge promotion, or before they got discharged, so they will not have the waiting time for them to receive the long-term care. So in every healthcare facilities, they will prepare elderly with discharge preparations, including evaluate case need and assist in the referral of national health insurance for them to provide with integrated care program in the community. So if the elderly before discharge, they find out they have the need in the basic home care or severe home care needs or at home hospice, then in the hospital before discharge, the long-term care will be referred to them before discharged. So this is what we have with the long-term care system here in order to create a sound fund of our long-term care service system by ensuring care and the supported service quality as we develop this accessible, diverse, and affordable service while safeguarding the dignity and right of the both caregivers and care receivers. The Long-Term Care Service Act has been legislated for on the June of the 2017, and the act was last amended in 2021, and the amendment focused on the key aspect, including clarify related regulation authorities and define all kinds of violation of fine. So the act fulfills the practical needs and legalize the related authority of special arrangement and payment audit system. We hope to provide more effective and high quality long-term care service through this kind of amendment. So to improve the service efficiency and expand capacity, encourage multiple service providers to join the long-term care system and provide person-centered service. The Ministry of Health and Welfare promotes the payments and benefit systems providing long-term care service, including care and professional service, transportation service, and respite service, and auxiliary application service, and the home accessibility improvement services. And between October 2021 to September 2022, the number of the people using long-term care service has been dramatic increase, which means the utilization coverage rate of the long-term care service is almost reached 70%. And the development of, a community-based integrated care service network through establishing the community integrated service system, which we will call A, will combine with the service center B. This is ABC, right? And the long-term care station around neighborhood block C. As of the end of September 2022, the progress thus far was expected. So right now, they has over 11,000 care providing service centers in total. So based on the community life circle, the daycare centers need to be set up in every junior high school district to provide the daily life care service for those need long-term care in the community. And at the end of September 2022, the daycare center was set up in 668 school districts already. So the target completion rate is over 80%. Increase in affordable residential institution with the goal of one township, one residential long-term care institutions. So in the next 4 years, priority will be given to setting up affordable accommodation style long-term care institutions in villages and townships. that have demand for accommodation institution, but lack of resource. So as the end of September 2022, the residential long-term care institution has been located in 296 townships in Taiwan. So the target completion rate has also over 80%. So by the end of the October 2022, there will be 56 application of the those in need, and it is expected to be planted and build up all this the 55 township in 90 counties and cities, and people from all over the countries can obtain this affordable residential long-term care service resource nearby and at a reasonable price they can afford. And to ease the family care burden, improving the family care quality, and develop the suitable service in different places, Ministry of Health and Welfare promotes the family caregivers supportive and innovative care plan so that they can provide individualized and group service, as well as encourage local government giving support to family caregivers through innovative and localized ways. However, finally, when life saving is not possible, we know it is difficult for families to say goodbye, but we still need to prepare for every elderly to do so. So as you can see here, that the quality of death index overall score in Taiwan has been quite high around the world. And I know there's even a better ranking right now. This is the ranking in 2015. So Taiwan has been ranking number 15. Is better, right? But in Asia, it's the number 1. So since 2019, we has enacted this Patient Right to Autonomy Act. So on top of the good dying that we have promote elderly to have their advanced care planning to decide their own way of dying and to decide when to say goodbye. So on top of that, we are hoping in the future, we are not only build up this age-friendly city, but also dementia-friendly city and a compassionate city. Means that how can you to say goodbye as you planned it. So finally, we are going to look at what the roles of nurses in what we can do to provide what nurses to have their great role in providing better care for the elderly. So no matter on the health status of elderly, whether or not is healthy or disabled, every individual elderly will need these 3 components of care, just different by its proportion. For example, the elderly with medical care needs or in their acute medical care stage, they will not only need life care, they will need the social care. They will also need support for the national health insurance, such as outpatient or hospitalization care in acute care settings, the setting for care including clinics, hospital, intermediate care facilities, or rehabilitation institution. But this elderly will also need a social service. When they travel in or out of the hospitals, he or she will also need someone to send him or she meals or working on the housework. So that's just the proportion different, but all these three parts of the cares are needed. But for the elderly who suffer from serious chronic disease, loss of physical function to a certain extent, they will need social care, acute medical, and long-term care. All three are very equally important for the elderly and must be coordinated division of the labor so that the elderly can be provided with continuity integrate care, but also can prevent them from the strength of the acute medical settings. And finally, for healthy elderly, it will be the Mickey Mouse style. What we mean by Mickey Mouse style, the primary care for the elderly is the healthy elderly. So occasionally, they probably will need this kind of, most of the time, they will need some social support in the community. But sometimes they will have to go back to hospital for medical checkup. When they are going in and out of the hospital, maybe the transportation is needed, provided by the long-term care system. So this is what we mean by the Mickey Mouse style. But in Chinese saying, how come this is not built up? In Chinese saying, we are saying this is the 5 olds. So that means that they will need keep their physical healthy with a companion and with a good housing so they can stay, and with some money, with some social security, and finally they need to keep the social participations so that they will enhance with this kind of active aging models so that they will have encouraged with their social participation, keep healthy, and the social security as we mentioned. So this is the model of active aging has been realized that we all can enforce in the community. So for the elderly, we means that they all have some chronic care needs. So as nurses, we will be the best candidate to lead the healthcare and long-term care service for our elderly clients, since 80% of them with some chronic conditions. So we are the best person to control their chronic condition in the community, and how to proactively integrate between activate the community and prepare them for the long-term care, comprehensive long-term care. So as nurses, we should follow up this kind of assessment, follow up on these three functions of public health. First, assessment, and try to develop some plan for them, and finally, make sure all elderly will receive the care they needed. First, in the assessment, we need to know number of people in need for care and what's their health status look like, and what kind of social environment factor influence their use of the service. So as we mentioned about the healthy aging society, the healthy city project, everything, all the dimension we mentioned, and whether or not the healthcare system can respond to their need. It's not only available, they need to be acceptable, affordable for the elderly, and whether or not the elderly will use the service, and whether or not the need can match with what they need. And the next, if it's unmet need, then we need to develop this kind of needed service provided for the elderly. So we assess current policy, current service, and find out the gap and try to identify what's the most priority area, and make sure there's a need for change in the policy and system, whether or not they can call responding to the convention on the right of person with a disabilities and try to establish the minimum standard for elderly to receive the quality of care. And finally, involve elderly with their own wish or their own choice, respect their own choice of care. And finally, is the assurance to assure all the adults with the disability whether or not their care has been all received and whether or not the financial incentive is enough for them to use the service and to consider whether or not all the care is needed and to update what kind of plan is for the elderly. And finally, I think the elderly care needs with the increasing aging society is a global issue. Taiwan has no exception. The prolong of average life expectancy, improvement of public health and enhancement of living standard, and the surge of elderly population so that the burden of care has been increased heavily. So it cannot rely on the family alone. So we need all this policy and service renewed and updated to advocate for the elderly. So we nurses need to provide this kind of service and educate elderly with all this needed service available for them. And most importantly, whether or not we have enough research-based data to support all this required service. And we think this is a great opportunity for nurses to expand our role, not only on direct care in the medical care settings, but also in the communities. Nurses has been working everywhere as needed from the day before the day the baby was born. So we start to work in the prenatal care to hospice to palliative care in the end of life. So we need to take the golden chance to get into the elderly cases for our future role development. So that's all my presentations. So thank you all for your attention.